From Constitution Hill here in Braamfontein, Johannesburg, and today a very, I think, informative and special occasion as we here to mark the launch of an app that has been developed specifically for victims of domestic abuse. Now, this is something that's been done by POWA. It's People Opposing Women Abuse. So I'm going to get straight into my interview with the director of POWA, Nonhlanhla Mokwena, and also joining her is Dr. Phumla, who is a gynecologist who works with women that have been abused. Good to have both of you. Thank you so much for being with us on Morning Live. This is a big moment for you, I imagine. I mean, we talk about POWA. We were speaking earlier, 36 years this organization's been around. This is called moving with the times, isn't it?
Yes, it's a great milestone for us. We've been around for 38 years, since 1979. And we've been providing services to survivors of gender-based violence throughout those years. And we have to move with the times as an organization. Currently, we are seeing that the people that are coming to us for assistance are young women between the ages of 21 and 30 years. Sure. And those are the young ones who prefer to use their phones more than calling in or SMSing. So we thought that it's a good idea to actually develop an app where they could just press and then be linked to the Department of Social Development Command Center, because they've got the infrastructure, they've got trained social workers who will be able to respond to those calls. But at the same time, as an organization that is funded by the Department of Social Development, and we have social workers who are trained to actually provide follow-up of these cases that go through to the command center and come back to us so that we can provide the one-on-one counseling and also the support group that the women require.
So this app, is it available now? Is it available on all on your Apple stores and whatever it is, Google Play?
It's available. It's going to be launched today. So today people will be able to download it, and then it will also be plugged into the command center of the Department of Social Development.
What is the app called?
The app is called the Power GBV.
So the Power GBV, that's what you look for. Is it a free app?
To download the app is free, but in order to use it, unfortunately, you'll have to use your data. But we are in consultation with mobile service providers to say there's a national crisis in the country. All of us have to chip in and do something to end violence against women. So how do we actually work towards ensuring that all women, wherever they are able to use this app? What happens if they do not have airtime? So then it means it's not only the responsibility of NGOs or of government, but it's also the responsibility of the private sector to come on board and say, how do we also add on and contribute towards ending the scourge in our country?
Yeah, certainly, and I agree with you on that one. I mean, you get major banking apps that are free, that you can use them, you don't need data, so it is possible and it can be done, and I think it's essential. So when you use this app, Doc, I'm going to be talking to you in 1 second. When you use this app, what does it actually do? So say I have been a victim of abuse, my husband has hurt me, I've got my app, what is it going to help me?
All you have to do is just press the app. When you press it, it plugs you into the Department of Social Development Command Center. And even if you don't talk, they will call you back. And if you don't answer, then they have located where you are, your address, and where you were pressing the app from, and then they can dispatch the police or an ambulance. So it's that easy, so that it's accessible to all women, and it's also easy to use. Because sometimes you find that you want to be talking to someone and the perpetrator comes in and finds you talking on the phone. But once you have pressed an app, you have actually alerted the command center that I am in distress, please help me. Yeah. That is why we have to work together. That is why we've invited the police to say, you need to respond quickly, because once someone has pressed that app, it means she is in distress, and we have to make sure we respond quickly so that if that person needs the police are dispatched quickly. If that person needs an ambulance, the Department of Health responds quickly. And if that person needs to speak to a social worker, POWA is available, and also the Department of Social Development social workers are available to also continuously provide follow-up for all these women who are calling and using the app.
Fantastic app. It really sounds amazing. Let's just hope it doesn't get abused in any way. Excuse the use of words. It's got to be used for very, very important and emergency situations. Now, you are a gynecologist. You're working with ladies that have been abused. My sort of sense out of this is I'd like to know, is it getting better, or are you finding that more and more women are coming to you, and how frequently are you treating women for this?
It's actually quite frequent, and perhaps it's not so much that it's getting better, but more and more women are becoming brave and are coming through. It's unfortunate in my kind of work is that by the time they come through, things have really gotten bad to be hospitalized or so on. And very often, particularly the ones that I see, you find that it's not just a woman who is, it's a woman who's pregnant at the same time. So it's not just one life that is in danger, but it's two lives. Or you find something that is becoming a trend as well. Very young teenagers where they start doing things like suicidal tendencies, and you're like, what is going on? And you realize the gaps in the gender violence. So people are out there and crying out for help, and the system needs to be just a little bit tighter in how do we manage and how do we then send someone back to the environment so that they are safe and they feel safe wherever they go back to. I mean, in hospital, we keep them, we get them all the help they need, but it's the follow-up after that. How do you make sure that when they go back home, they are safe wherever they go?
Well, that's the reality. As they go back into the environment, do they ever escape it? And is it just a continuous circle? Are you always seeing the same faces coming through? And also that age that you're talking about, the 21 to 30, are you also finding that to you?
I mean, if you look at the number of maternal deaths, for example, the largest group, it comes from those between teenagers up to the age of 24 years of age. And you think, how is it that our women, young, healthy, are dying? And you're like, it can't be, it shouldn't be. There is something that needs to be done, and fast. We are in a state of crisis, I believe.
I think we are too, unfortunately, and I'm glad you're doing something about it. And more importantly, I'm glad that you're going to have the Minister of Police here today, the Minister of Social Development. So let's get some answers and let's find out what they are going to do to get us out of this moment of crisis we're living in. Ladies, thank you. Congratulations, and thank you so much for being with us here on the program. Nonhlanhla Mokwena is the director of POWA, and also joining us was Dr. Mpumi Samilani. She is a gynecologist who treats the ladies that have been abused, and talking to us about how dire the situation actually is. Let's take a break. We'll be with you shortly.